a very heartfelt hello. I am Stacey,
I am Mike.
and this is Raising My Dad.
It is.
It is. So we left off, actually, we took a week off,
We did.
and it was a much needed week off.
It was nice.
Talk about taking a break, and we know we're only a few episodes in, but we need to take time for ourselves. And as caregivers, I hope that you guys are doing that for yourselves as well, because if you don't take care of you, you can't take care of anyone else.
Yeah, it's true.
So,
fair point.
yeah.
No, it was the 4th, so.
I wasn't going to say that, so cut
It's
that
okay.
out. Anyway, so we left off and we kind of alluded to the fact of this is the night that all hell breaks loose.
Was it?
And I do say
It
it's
was
all
at
hell
night.
break loose, but it's really not that bad. I was just leaving you on a
It
cliffhanger.
wasn't at night because you called me, I don't know, 10, 11, 12.
It was probably about 1, 2 o'clock in the afternoon.
I was so close. Yeah.
It
And
was
said,
in the afternoon. So here's what happened. So Dad and I had an appointment in the morning and came back. And as you know, we have nurses and physical therapy that actually comes into the house. Therapy. Therapist. Therapy. I don't know. Anyway, physical therapist comes into the house twice a week. And also the nurses, mainly to address his wound, which has healed fine on his knee. But they also check his vitals. So does physical therapy. So therapy.
How long was that? How long was his scar on his knee? It's like 6, 7 inches.
Yeah, there's a picture of it, but yeah, 6, 7 inches. So,
Just curious.
And while I was in Idaho, they took the bandage off and then just put steri strips on it.
Yeah, that's what he was waiting on for the fall off.
Yeah, because you cannot take them off. They want you to have them fall off naturally because it's the healing in the dead skin.
Yeah, I'd do it.
You would. You're a picker.
No,
You're
just
a
a rebel.
picker. I got some funky hair today.
You call me about 1:30, whatever time.
So
1,
anyway,
2 o'clock.
I haven't called you yet. So the nurse comes in and she's checking his vitals. And I'm not going to say the nurse's name, and I'm not going to say the company that comes in. But I will say about this nurse that she just kind of is like, meh. So she's checking his vitals, and he has a pulse oximeter on his finger, the thing that checks your heart rate and your oxygen level. And he's been doing this every time he gets up, he checks his oxygen. Every time he sits down, he checks his oxygen because our oxygen level has been pretty low. In fact, we're on oxygen at night.
True.
So she's checking his vitals with this finger thing, and we notice that his pulse is about 40 to 50 beats. And she says, "Are you feeling okay?" And he's already tired because we were at an appointment up the stairs, down the stairs, stuff like that. And he's like, "Yeah, I think so." And she's like, "Well, I'm a little concerned. Anything below," I think she said 60 at the time, "is of concern." And I was like, "So what do I do?" And I instantly go into, "Oh my God, what do I do? What is wrong? Like, what have I done?" And
what did you do?
What did I do? There's a story behind that too. So she says, "Well,
so you had to call."
So she had to call this lady and check in with her. And I'm like, "Wait a minute, why aren't you calling the doctor? Is this like a situation where we need 911? And she's like, "Well, I mean, you could take him to the ER." And I'm like, "What? What?" And she's like, "Well, that's really low and that's really of a concern." And I go, "Okay, we're going." And then I called you. Actually, I didn't call you. I called Cass. And asked her, because of the condition and the situation, which hospital would be best to go to. And Cass said to take him to the hospital where she is located at.
Correct.
Or yes. And so then I told her to call you. So now this is when you take over the story.
Oh. No, she just called me, said, I thought his pulse got down to 37.
Yes, at one point in time it did, because we continue to monitor it this whole time, like while we're walking and stuff.
So she just told me that and told me the hospital you were going to. And I left work, started my hour 15 journey.
Which I had no idea. I didn't know you had left. So Cass calls me back and she says, "Do you want me to meet you at the hospital?" Because I have the truck.
Yeah.
And I am not supposed to have the truck. Wait, so maybe I didn't have an appointment that day. But anyway, I know something had gone on. Maybe it was physical therapy was in the morning, and so that's why he was tired. But anyway, so I have the truck, which is really hard to get him in and out of. It is a fight. It is a struggle. It is a process. And we have only practiced this a few times, and it probably takes a good half hour up the stairs into the truck.
At this time,
yeah. And so here we are doing this, and Cass calls me back and, do you want me to meet you at the hospital? I'm like, please. I would greatly appreciate it. And so her and I, as I'm driving, are texting. Illegal, don't do it. I was only doing it at stoplights, which is still illegal. But anyway.
You have Apple Play, just use that.
I was in the truck.
It has CarPlay.
I know, but I was in the truck, so it wasn't connected. I was just worried about I got to go. And the whole time we're driving there,
crazy.
And Cass is like, okay, where are you parked and this and that and the other, and how are you going to do this and all the things. And the whole time my dad's going, shit.
Mm-hmm.
He's like, everything was going good. I feel great. He's like, just like when I had my stroke, I felt fine. And now something's going to be wrong. He is, but at the same time, it's like head is down and he's like defeated.
Mm-hmm.
Like one more thing. And I get it. And I feel bad for him. And I'm trying to talk to him. And I'm like, it doesn't mean that it's anything. And we already know there's a heart murmur. Hopefully it's just your heart murmur.
Right.
And we get there and there's nowhere to park. And so, of course, there's Cass. We get him out, get him in the wheelchair. Those wheelchairs, those metal wheelchairs are a pain in the tuchus. And then I have to go and park. And as I'm walking in, there's Jake.
Oh, yeah.
And I was so relieved to see him.
Cass called a brother.
Yep. And I was so relieved to see him because I was like, I don't have to do the heavy lifting now.
No, Jake will take care of that.
Yeah, big time. And so
big boy.
We got him checked in. They did an EKG right away.
Mm-hmm.
And his heart sounded fine. And then we sat in a waiting room and you came and made it there. And we sat.
And then we sat.
And then they did some chest x-rays.
And then we sat.
And then we sat. And sat.
Yeah, it was
and then we got called back to the room.
It's that place is sad.
So we were there for about 8-9 hours.
Yes.
And here's what I'm going to tell you about our situation here in our community. We have a few hospitals and a few ERs, different companies.
Mm-hmm.
And the one company closed down the other ER.
In the same town, but on the other opposite side.
And it's a pretty big town. We got a lot of people.
Yeah.
Within all the cities and traveling distances and everything else and surrounding outlying areas, counties, however you want to look at it. Because there's people that will drive an hour.
Okay.
And they shut it down. They opened a very small one, but they can barely do anything. No diagnostics, no MRI, no nothing like that.
More for bumps and bruises.
Yeah. And pregnant women eating dinner, falling asleep, little kids cuddled up, miserable in mom's lap, dad's lap.
Mm-hmm.
When we finally got back to the room, I had gone out. I had to get something out of the truck. And you were with me. And there was a gentleman handcuffed to a bed.
Yeah.
In the middle of the hallway. There was a young girl out in the hallway, a teenager, coloring. And this is once you get back in. Like, I don't think she ever had a room.
Yeah. No. Oh, yeah. Sitting on the bed in the hallway. Yeah.
And a nurse was out there coloring. And the thing is that a lot of it is mental health. And I get that because our mental health system is broken. I don't want to get political, but our healthcare system is broken too.
Yeah. It was crazy. So, but Ray gets his room. We start going over everything.
And it's test after test after test. And it's no answers and waiting and waiting and waiting.
Mm-hmm.
And then we had the nurse. Doctor came in first and just did a brief over assessment. It was like, okay, we're going to order a
When
chest
this
CT.
happened,
We have to get blood work done.
You
stuff
got
like
taken back. Is that when did I go get supper?
Maybe.
Or food or something? I left.
No, because they wouldn't let us have food. You went to go get chargers, the blocks.
Yes. His phones were dying.
Yep. So the doctor had come in and done just like that general assessment and like ordered the test. And then it was wait. As we are waiting and not getting answers, all of a sudden a different nurse comes in and is like, you don't have this done and you don't have that done and you need to pee in a cup. And my dad is like, can I ask you what's going on? Like, well, what are you seeing? What are you showing? And she goes, I asked you to pee in a cup. And I was like, what? And she's like, oh, you don't have this hooked up. And I said, oh, well, when we got in here, the other nurse didn't hook it up. And she stops and she looks at me and she said, well, I'm in charge now. I'm the nurse. And this is how I do things. And I went, oh, we're going to have problems. So then my dad asked another question and she just dismissed him and ignored him.
Weird.
And because he couldn't pee in a cup, he couldn't go back and do whatever other tests. So he got put back in that line. And then we ended up...
At this time, we're peeing in urinals still. We can't pee in a cup.
Well, no.
You could transfer it, though, too.
He wanted to get up and go to the bathroom because he is capable of doing that. And she wouldn't let him. She was like,
that's
no.
right. I'm sorry.
And he's like, but I can get up and do it. And she's like, no. That's
right.
You're all hooked up. And then I said, he needs to take some medicine and he's really hungry. We've been here since 2 o'clock. And she said, no, he's a patient. And I said, well, is he being admitted? And she goes, no, but he can't have anything. And it's his antibiotic, which he has to have. And looking back, you'll realize that we could not leave Idaho without this medication. And it's the bacteria antibiotic that is, if it comes back, it rears its ugly head and it's awful and all these things. And she just kept telling me no. And we all know what I did.
What'd you do?
I'm texting my 2 besties.
Oh.
And I'm like, who is this? And I am taking pictures of this person and sending it to my friends and being like, it's a travel nurse.
Where's she from?
No idea.
So you go talk to somebody because of this nurse.
I didn't talk to anybody. I was told to go talk to the charge nurse. And I went to go talk to the charge nurse, but she was in someone's room. And so she was supposed to come see me. She never did. And so I think it's after midnight at this point in time, and we still have no idea. And he just had gotten taken back for his MRIs.
Yes, probably. Yeah, it was late, super late.
Because if you've never had one of these things with contrast, he's like, I thought I peed my pants.
Yeah.
The pee your pants feeling.
Yeah.
So
I've had to do it a few times.
Yeah. So it's after midnight.
Pee my pants, not use contrast.
We still haven't heard anything.
Sorry.
You have to work in the morning. You're getting exhausted, but you're still trying to help take care of us. My dad's exhausted, but at least he's sleeping in the bed. Amanda comes down to check in, see how things are going.
Our son's wife.
Yes. And that was so sweet of her. And it, really made him smile. And then we get the news. My dad's brain does not have any fluid on it. There's no infection. There's no brain bleed. There's no stroke. There's no nothing. His chest CT scan, they asked us first based on the x-rays. Oh, yeah, because remember they lost the x-rays.
I don't remember, but yeah.
Because they're like, oh, we need to take you back.
I was so tired.
I know, but they said we need to take you back for x-rays. And you stopped and you're like, no, he already had x-rays.
Oh, yeah.
And so the x-rays, they came in and said, has anyone ever told you have congestive heart failure? And you and I just both looked at each other and went, no, not again.
Yeah. My sister just passed away from that a year and a half ago.
Yeah. And so we were like, no. However, we knew that, medication and, preventable things like that or, lifestyle changes slows the progression. And then we're waiting and waiting and waiting because they wanted to follow it up with the MRI or CT scan. However, I don't even know the names of tests anymore at this point in time.
Medical tests. That's what they're called.
And so the brain showed fine. In his chest, they saw that obviously he has the murmur and stuff like that. But they also found a blood clot in his lung. In his lung. And my heart sank into my stomach because you hear blood clot in your lung and you're like, you're dead.
Dead.
You're just dead. And my dad heard it and he just went, what does that mean?
Yeah.
And he's like all over back in Idaho going, I'm screwed. I'm done for. This is it.
Back in Idaho, I mean, I don't think he talked on it, but he was ready to like give up.
Yeah, he said.
Which you can talk about that at a different time.
I probably talked about it at my table talk, but he said that he felt hopeless and ready to give up on life. He just was done.
Right.
And you could tell he was right back to that place. And
yeah,
then it was he needed to be checked into the hospital. And now here's the fight inside of me going, I could get a really good night's sleep. Or I can do what I should do and stay in my mind. I should stay with my dad. He's now in a new hospital. If he wakes up in the middle of the night, scared, confused, any of those things, I should be there for him. I'm the familiar face.
Correct.
And so you and I go outside to talk, and you're like, I really wish, you know, he's in good hands. Please just come home, get a good night's sleep. You know, I'm not going to work tomorrow. You know, you need sleep. You can't keep doing this because I'm obviously waking up constantly in the middle of the night.
Right.
And so the internal struggle kicks in because I just feel so selfish at that point in time for even wanting to go home and have a good night's sleep.
Everybody, we're human. We all have selfish moments.
But I mean, what's going through your head? Because you're like, so I'm caregiver. You're along for the ride.
I'm probably calling into work tomorrow.
But besides that,
honestly, I mean, just I hope he doesn't die. Is this like, you know, the it?
But I mean, you're watching me go through this now.
Yeah. I mean, I'm a dumb plumber, so I don't know. I know what stuff is, but I don't know what it means.
Yeah.
In a lot of regards.
Yeah. So we come to the whole idea that I'm like, I'm just going to stay. I'm just going to stay. We've decided this, go back inside.
Excuse me.
And then the nurse comes in and says, so I've consulted with the main, I don't know, the main doctor, maybe the doctor, the director of doctors. And she says, so
Dodd.
The Department of Defense?
Director of Doctors.
Okay.
You talked to Dodd.
I was Department of Defense is the DOD.
I know,
but
I was joking.
The Dodd. So we are one brain. We know exactly what we're going to do. We're ready to go in. You're going to go get me clothes. You're going to come back, grab like some snackies. What's open? Because, you know, post-COVID, nothing is ever open this late at night. And she says, well, I've consulted with him, and whatever type of blood clot is, it's not like completely blocked. So blood was still flowing.
It was a smaller one.
And obviously, if it was closed, completely damaged would have started to happen. And I'm assuming a stent would have had to be put in, things like that.
I don't know how that works.
I'm assuming, right? Because I'm not a nurse or a doctor, so I don't know. And I'm still at this point in time pissed at this nurse.
Oh, yeah.
I mean, just like texting, like I'm going to, and the thing is that yes, I get that she's just doing her. Yeah, I'm very violent at that point in time. And I know she's just doing her job. I know that there's a lot of patients that are combative. We have friends that work at this, our kids work in this hospital. They hear stories. We hear stories. People getting punched, stabbed.
We're all human.
You know, so, and I get it. And who knows if she didn't have a bad day. But let me tell you, when you are that rude to a 79-year-old man who just doesn't get it and just wants to feel like, can you just explain to me what's going on?
That's really what he wants. He has a hard time hearing. He wants you just to explain it. You have to have a little bit of patience with him.
And that he just wants to be treated like he values, and like this is his life, and don't just talk to me, and just don't do whatever you want because he doesn't hear you, and don't ignore him. Like he's a human being, treat him with decency.
Yeah.
So this is why I'm pissed. And my dad realizes that I'm mad, and he's like, calm down. And I'm like, you don't treat people like that, Dad. And, you know, he's like, well, I'm, you know, glad I'm on your side, but I still need to get treated here. So we hear about this, and she comes in and
Like
says,
served.
it's not that big of a blood clot, as I call it. It's not that big of a deal. So he could stay over, but if he stays over, it's just for observation, and it's not necessary because they wouldn't be hooking him up to IVs. He would just be getting these pills, and
which he could take it home.
And now my brain goes, when my husband, which is you, had a blood clot in your leg, not in your lung, in your leg. Not that you don't need your leg.
That's not the problem, is
right, but you got rushed to Iowa City in an ambulance, and oh my gosh, and you know, wake up in the morning to 12 doctors in your room. Granted, it was a learning hospital, and they were all attendees and all that, but you know,
tenders. Anyways,
so that's what I was expecting, and they're now acting like it's not that big of a deal.
On mine?
What?
On mine or Ray's?
Ray's isn't that big of a deal.
Yeah.
Dad's isn't that big of a deal, but it's in his lungs, so which I think it should be more of a big deal. And so I'm asking 1,000,001 questions so I can help answer his questions, because this nurse ain't going to be the one that explains anything. And so then it's, well, if it's not that serious, maybe I really don't need to stay with him. And then we start having that conversation, and he decides that he should stay. And we're like, okay.
Perfect. I'll go get stuff.
Yep.
If this is what we're going to do, that's fine. I'm tired as hell.
Yeah.
But I'm going to get it over with. So I'm getting ready to take off.
And then we find out that Medicare might not cover it.
True.
And the whole bottom drops out. Because I have no idea what this hospital bill could be.
Right.
And it's just for observation. And we're like, what do you need to be observed for? It's a blood clot. Could it move? Could it not move?
Is he at risk or not?
Right. Like,
if you're at risk, you stay. If you're not at risk, let's go home.
Well, and then it's like, if he's just staying and you're not going to have him hooked up for anything, and you're just going to give him his medication and charge him, you know, triple the amount, what's the point? He can stay at home and watch TV. Well, I don't know. I'm just throwing stuff out 30. There. I'm talking through my
microphone.
Yes.
Yeah.
So, and then he's like, I can just like go home where I'm comfortable, which home is here, and do the same thing. And so we did. And I think it was 3:00 in the morning when we got home. Because I had to send you home.
And they had to run more tests because he had the nurse come in, the one you did like, that was very nice.
So they found fluid on his lungs.
Correct.
And they were afraid that it was infection again.
Or pneumonia.
So they had to run more tests. And the cutest little nurse.
Yes, she is.
She has the sweetest disposition. She is tatted up, tiny, itty bitty, just bundle of cuteness.
Yeah, she was cute.
And she was so sweet to my dad.
She was.
And we asked her if she wanted to be a nurse, and she said she always thought she wanted to until she worked at that hospital.
Yes.
And I went, that's so sad.
It is.
And that hospital is so sad, like the people in and out. It really, really is. And so she might have been like the bright spot in that hospital.
She was. The doctor was good too.
Oh, yes. The doctor was wonderful. I will tell you, she sat down, answered all his questions, and my dad would sit there and go, now, wait a minute.
Now, hold on. Sorry. Ray, when he explains something, it might take me or you or anybody out there a minute to explain it. For Ray, it's going to take a few minutes.
So, so you'll ask him, and you'll say to him, like, so have you ever had knee pain before? and he will take you back to high school, and then to the 60s, and then to 10 years ago, and then to when he worked on the bridge, and then to the surgery, or then when he fell in Thailand. And so you will not get a straight answer. And there is no yes or no.
Yeah.
Ever. There is a story behind everything.
Mm-hmm.
And
that's that generation.
And there are doctors who have zero patience for it. And it very much shows. And it very much rubs him the wrong way. And he gets very agitated when it happens.
But the ER doctor was very good.
Yeah. She sat down next to him and she explained everything. And then, like, I did my thing and I said, if you let that nurse come back in this room, I'm going to tear her to bits. Mm-hmm. And she kind of looked at me and I said, do not allow her back in this room. I don't want her to step 1 foot in this room. And I'm going to tell you why.
Correct.
Which was, my father deserves some dignity and to feel like a human being. And she dismisses him and ignores him. And he tries to repeat himself. And then she gets aggressive. And I'm not handling it. And my dad needs his medicine. So she let me get his medicine. And she was like, absolutely, he needs it. That's not going to interfere with any of the tests, you know. And granted, she didn't say the nurse was wrong. She didn't say I was wrong. She didn't say either one of us were right. But she did say that she understood. So that was nice. And when we left the hospital, I had sent you home to kind of grab the things and do all the things. And the nurse apologized to me. So that was nice.
So we all in separate cars, obviously. So we got to get Ray in the car. Did I go get checkers? That sticks in my mind for some reason.
Sorry. I think we had something because I remember we like ate when we got home. And then we sat in the hot tub. And then we passed out.
It's kind of funny too. One of the nurses, not the nurse that was working on Ray, but just one of the nurses was one of your old cheerleaders.
Yeah, so we walked in to the ER and I don't expect to know anyone in there because my bestie isn't working. And so all I hear is, oh my God, Stacey, what are you doing here? And I go, I live here?
In the hospital.
Right.
I live in this hospital.
I just thought, I live here? And that was the first thing that came to my mind. And I look over and there she is. And I'm like, why are you not in high school? Like your brain.
Right. Even though our kids are almost 30 now.
And she's getting ready to get married. And I still think of this 16, 17-year-old kid.
Well, I mean, out of sight, out of mind.
And then she asked something. And I was like, you can only have so many people back in the ER. And because it was her, she wanted to see you. So she went and got you and all that. So.
True story.
And
so we get home.
So tired.
We get him to bed.
Body hurts. I am.
I don't remember if we sat in the hot tub or we just said screw it.
No, we did. I said that we were both so tired and so sore. And we were like, I don't care if it's just 5 minutes, just to like let our bodies like.
And that's when it was still cold out too.
A little bit, yeah.
Chilly.
And so we went to bed. I mean, we had to, text Scott and talk to Scott. And I think my dad had to talk to his brother and there was some other calls coming in. And he just, even at 7:00 at night, right? He was just slurring every word that came out of his mouth.
You being tired?
Yeah. So you would talk to him, he'd be like, yeah, so I'm going to go. And he would just stop. I mean, just so tired.
Right.
And I mean, he's already been poked and prodded. He's already been in the hospital once. And he's probably like, here we go again. I'm stuck for another month.
Yeah. I mean, that's all I'm sure he does. Every time he hears something, it's another month, another 6 months. So, so that was our ER expedition.
That was our ER expedition. And that is like that. Oh God, we got to get moving on this stuff. Like all of we have to get these appointments now and the primary care doctors and now it kind of sits in like the reality of this isn't just an infection and a knee surgery.
Right.
this is a whole, and a heart murmur.
Yeah. So we can get into that on the next episode.
Yeah. Yeah. This is a whole lot more. And this is,
Right.
I'll be honest, at the time, seeing my dad and knowing that obviously infection causes confusion, knowing that it's going to take, 3 months, 6 months for my dad to get walking better and doing stuff like that. Never thought, well, we have a blood clot.
Yeah.
And then I'm thinking it's my fault because we just drove for 4
It's
days.
the opposite of a blood clot too.
What do you mean?
Aneurysm.
Yes. We found that out through the test that we have an aortic aneurysm.
So you're on blood thinners while you have an aneurysm.
Yeah. So
what do you do? Nothing you can do about it.
Right. And, you're asking all the questions about all these things complicating themselves. And then you're doing PT and everything is exhausting. Everything is exerting. Like taking 10 steps makes you tired. Taking 15 steps makes you out of breath and you're kind of panting. So you're on blood thinners. You're in physical therapy to get your leg better and to get walking again. But everything is strenuous for you. And what do you think that the doctors say? No strenuous activity.
So, and we'll get into that. That's something we can start in on in the next episode.
Absolutely. But until then, where can people find us?
You can see us on all of our social medias. They're always in the description, I think. I try.
Yeah.
I try.
We're still newbies at this.
Very newbies.
So, but until then, go out, be kind, tell someone you love them.
Check in on your loved ones.
We out.